Okay, so today I'm going to be going over the first trimester, basically including and specifically the first prenatal visit. Okay, so like we went over a little bit before, pregnancy is 40 weeks from last menstrual period. So last menstrual period being here, okay? At about 4 weeks is when you get the missed period and positive pregnancy test, okay? A lot of people ask when to come in for the first prenatal visit. There's two real possibilities. Coming in earlier than 6 weeks, unless there's something specific to be concerned about, doesn't make a lot of sense because you're not going to see anything on ultrasound until probably about 5 to 6 weeks. I oftentimes will see people at 6 weeks for what I call a confirmation of pregnancy. So do an ultrasound to make sure that the pregnancy is measuring at the correct size for what's expected. 8 weeks is normally what we consider the first prenatal visit or the initial prenatal visit. And that's what I'm going to talk about a little bit. Like every visit in medicine, we do a history and a physical exam. In this particular visit, the history is very, very important, and I'll talk a little bit about that. A big part of the exam is the exciting part, and that is the ultrasound. We'll talk about what's seen on the ultrasound at about 8 weeks, and then the next visit is usually at 12 weeks. That's another huge topic because a lot of things are done at the 12-week visit, and I'll cover that in another video. Okay, so the history, like I said, is a very important part of the first visit. The medical, surgical, prior obstetrical, gynecological history, your doctor is going to ask all about that. Very importantly also is family history. Your doctor will ask about prior history of birth defects, prior history of problems in pregnancy, medical problems in the family, things like that. It's great actually to ask your family, which you may not have before, about issues that they've had, either genetic issues, problems with childbirth, medical problems, genetic problems, things like that. Medication and social history is also very important. Really important, like I've said before, to be very honest with your doctor about this. Lots of people have had drinks, things like that, before they have a positive pregnancy test. It's really fine. May have taken medication before you got a positive pregnancy test or even afterwards, and it's really important to be really honest with your physician about that. So that's medication, social history, you know, smoking, things like that, prior history, prior obstetrical history, whether it's miscarriages, issues in the prior pregnancy. Very important is if you've had prior pregnancies or deliveries to have records transferred if they're not at your current physician. So the history, you'll go through everything. Your doctor will talk to you about what blood work and things like that are necessary. The initial blood work is normally a blood count, a blood type, to see whether you're immune to a few different things like chickenpox. And then if you have some additional risk factors, in other words, if your parents have a history or your family has a history of genetic diseases, your doctor might talk to you about testing you for a specific thing. So here's the exciting part, the ultrasound. It's what everybody wants to see. It makes everything seem real. Like I had mentioned before, at about 5 or 6 weeks we can see something in the uterus. By 6 weeks we should definitely be able to see a heartbeat. Most providers will ask you to come with a comfortably full bladder so they can look abdominally, but the majority of the time we have to use transvaginal ultrasound to really see what we need to see, get closer to the uterus. So, the ultrasound machine, most will look generally like this. There's two probes. This is the abdominal probe, it goes externally, and this is the transvaginal probe. Not too uncomfortable. Basically, what we're going to see at about 6 to 8 weeks is what we call a fetal pole. There is a gestational sac, which will be a round or elongated area. Black is fluid on ultrasound. Inside that sac, there is what we call a fetal pole. That's the baby. We measure the crown rump length, or head to butt, of the baby, and that's very, very accurate in telling how far along you are within 4 or 5 days in your first 8 weeks or so of pregnancy. This is another view of an ultrasound at about 6 to 7 weeks. Again, you're seeing the gestational sac, which is in the uterus, and then you're seeing the crown rump length here. This is actually that same patient a week later. We see the fetal pole here. This is called the yolk sac. That's present during the first trimester of pregnancy. Very round and regular adjacent to the baby. Also, you're not going to be able to hear it, but we can visualize today the fetal heart rate at about 6 to 7 weeks. Be able to see that. Important things to know about the first trimester: your body's changing a lot, blood volume's increasing, so you're likely to feel out of breath, exhausted, you may feel nauseous. Talk to your doctor about things you can do to help your nausea. If it's severe, there is safe medication that you can take during pregnancy. Small, frequent meals. Very important to drink lots and lots of water. Take a prenatal vitamin, and just take care of yourself the best you can.